The number of Arkansans on ventilators reaches an all-time high. Medical centers are continuing to closely watch their ICU beds as the surge continues.
Katrin Asaph checked in with Little Rock hospitals on where they stand when it comes to bed availability. She's live at UAMS for us tonight. And Katrin, it seems like we at least have a few more beds than we did this time last week.
That's right, Laura Bob. According to the governor, we do. Governor Asa Hutchinson tweeting earlier today that we are seeing a slow increase in the number of open beds at hospitals between an increase in ICU and COVID surge capacity. But even with a few extra rooms, there's still concern, and it doesn't necessarily have to do with space, but with staff. It feels like a never-ending math problem, the number of open beds related to COVID cases, a balancing act Little Rock hospitals have faced for a year.
It's really just a numbers issue for us.
Dr. Stepi Mete with UAMS is one of those working to solve the equation. But with COVID cases spiking, hospitals have had to adjust.
Take beds that are currently used for different reasons and appropriate them for surge capacity.
Tuesday, Governor Asa Hutchinson took a look at the state's open beds. ICU capacity is up by 17, and Arkansas now has a surge capacity of almost 700, beds repurposed to meet demand. Baptist Health has added 87 beds in their centers, with plans to up that by 70. As for UAMS, their limit is 144, with 66 COVID patients currently in their care. But the severity of the cases,
about a third of them are in an ICU,
is what's concerning, and physical beds aren't the issue.
It's not the space, it's the staffing.
The national shortage of healthcare workers is the major roadblock, with the issue of keeping the hospital staffed without overworking nurses.
Rethinking the staffing ratios, doing more team-based care.
But with hospitalizations reaching all-time highs, the best medical centers can do is continue to watch and make adjustments one day at a time. Now, Dr. Mete says the best way that you can help out healthcare workers in hospitals is simply to stay healthy. He says the best way to do that is, of course, to get vaccinated, to wash your hands, mask up, and to social distance. He also adds that we are all in this boat together, and if we want to turn the tide on COVID, it's going to take us all working together. Reporting at UAMS, I'm Katrin Asaph. Back to you.
Katrin, thank you.